So developing right now, an emergency room at a Houston hospital is getting so full that the hospital went into what it calls internal disaster mode.
That was the unfortunate reality yesterday for the staff at LBJ Hospital in Northeast Houston. Some patients who were admitted to the ER had to wait as long as 30 hours for an available bed.
And while the hospital is reporting more COVID hospitalizations, that's not the only reason for the ER strain.
Our Michael Leparty live in Northeast Houston with this story tonight. Michael?
Dominique and Chris, this is the emergency area just behind me and across the street. A doctor told me that internal disaster mode means that the hospital is off the grid for patients coming in from areas like the Houston Fire Department's ambulances, for example. But that doesn't stop people from showing up here in person, and some who did faced a long wait time. While the emergency room at Houston's LBJ Hospital may seem quiet from the outside, the inside was quite the opposite last night. At one point, the hospital says wait times reached up to 24 hours, with 130 people waiting to be seen. That prompted a frustrated doctor from Harris Health to email lawmakers, writing the hospital went into internal disaster mode. Quote, with COVID once again at elevated rates in our county, our hospitals are once again strained. And quote, we are at an untenable state.
I was feeling the anxiousness in her message that she needed help.
State Senator John Whitmire was on the receiving end of the message.
If citizens of Harris County and Houston are waiting 24 hours in an emergency room, that's just unacceptable.
Harris Health is blaming several factors: a growing surge of COVID patients combined with a large number of non-COVID patients and a shortage of nurses on top of all that.
When you put all of that together, it kind of creates that perfect storm scenario.
President and CEO Dr. Esmail Porsa knows he has a staffing issue. He's short 140 nurses at LBJ and Ben Taub hospitals combined. He says part of that is because of a national shortage, though some are also sick and some have left.
I'm frustrated. And I am disheartened that I don't get the feeling that people understand the gravity of the situation that we are in.
He also told us the latest surge is developing faster than the last one, and he's worried things will only get worse. The president says that the state was previously providing some temporary nurses, but that's no longer happening. So Harris Health now plans to close some of its clinics towards the end of the week so they can move those nurses into the hospitals. And it's also considering cutting back on some elective procedures to free up more nursing staff. We're live in Northeast Houston tonight. Michael Leparty, KPRC 2 News.
And Michael